Today I'm going to talk about vitamin D. It is a very, very, very important vitamin. Is it a vitamin? Yes, we call it a vitamin, but it is a hormone or a pro-hormone, right? So let us talk about vitamin D. So vitamin D is very essential for maintaining healthy bones and teeth. We all know that nowadays when we go and check the vitamin D, most of them have a deficiency of vitamin D, right? And why? Yes, so I was talking about why do we need vitamin D. So as I said, it is important for maintaining healthy bones and teeth, which we have learned from the school itself. It also plays a major and important role inside the body, including regulating the inflammation and immune function. Okay, so despite its name, as I said, it is said to be a vitamin, but it is a question mark if it is a vitamin or a hormone or a pro-hormone. Pro-hormone means something, a material which is then converted into a hormone that is called pro-hormone, right? So um vitamin D promotes the trusted source. It is the trusted source of calcium. Means it helps in absorbing calcium. It helps in absorbing the intestinal calcium. Whatever we uh, intake from the food, it goes inside the stomach and then into the intestine. We all know that the intestine, it absorbs all the nutrients. So vitamin D is important for absorbing the intestinal calcium. It helps in maintaining the blood levels of calcium, because after absorbing time, it is supplied into the blood. So the blood levels of calcium and phosphorus are maintained because of vitamin D, and it is important. It is necessary for the healthy bone mineralization. So vitamin D deficiency in children, it can cause rickets. Now what is rickets? The bones are a bit softer and they form a curve. Their legs can see a bit curvy. See, when the child stands up, we can see instead of straight legs, they have a curve that is called rickets. Or if it is not treated, the bones can get crooked also. So that is mainly because of the softening of the bone. As I said, vitamin D is important for mineralization of the bones. So if that is not happening properly, the bones will remain soft and they deform. Similarly, for adults, vitamin D is important because it can cause osteomalacia or osteoporosis. Because again, when calcium intake is done, if proper vitamin D is not there inside the body, the absorption of that calcium does not happen and the bones, they become soft, and it can cause a head muscular weakness. And so long term vitamin deficiency can also, yes, or when osteoporosis happens, when there is a long term vitamin D deficiency. And what happens when somebody is suffering with osteoporosis? So we have heard that many of the aged people, they fall into the say bathrooms because the floor is wet, and some fracture is caused because their bones have become weak, right? Their bones have become porous. That is called osteoporosis. Now vitamin D also plays important role in the immune function. It is believed that they are the link between the conditions like development of autoimmune diseases and some other conditions like diabetes. Diabetes can also be sometimes due to autoimmune, that uh, our immune system goes and attacks the pancreas, and then the pancreas is not able to produce enough insulin. So that is called autoimmune type of diabetes. So there are many different types of autoimmune diseases. So diabetes, asthma, rheumatoid arthritis. These are few names about autoimmune diseases, and there are several other uh, which have complex names. So it is said कि deficiency of vitamin D can cause autoimmune diseases. More research is definitely going on this topic, but why to take the risk, right? So how do we get? Uh, what are the symptoms? Yes, so symptoms, as I said, bone fragility. If somebody just slips somewhere and the bone is fractured, it means the bones are become porous. Their bones are fragile, right? Then bone pain. Several times it happens ki there is no reason, but the bones is paining. Sometimes the hand is paining, sometimes the leg is paining. So bone pain is one of the symptom. Then fatigue, we feel tired if there is less amount of vitamin D. Muscle twitching, and many a times we see eye is twitching. Not only eye, but the muscles somewhere they start twitching. So the muscle weakness, muscle pain. Many a times, the elderly people they say ki there is some cramp in their legs. These cramps also are because of calcium deficiency, and calcium deficiency is caused because of vitamin D deficiency, right? So muscle weakness, muscle twitching, joint stiffness, arthralgia. Arthralgia means joint pain. These can happen because of long term vitamin D deficiency, and it can result in several complex conditions. What are these several complex conditions? So it can be a cardiovascular condition. As I said, it can be a autoimmune disease, neurological diseases, infections, pregnancy complications, certain cancers, including breast cancer, prostate cancer, colon cancer, right? So there are several problems which can arise because of vitamin D deficiency. What are the sources of vitamin D? From where do we get vitamin D? So the main source of vitamin D, we all know that it is the sunlight. So we should go in the sunlight and expose our skin to the sunlight so that uh, our body can produce vitamin D with the help of the sunlight. However, there are several people who can have uh, problems in absorbing that sunlight and creating vitamin D. So, what can they do? So, they can go for a supplement of vitamin D. Yes. So, for example, winter season there is less amount of sunlight. Then areas who have 6 months of no sun, what can they do? They have to go for supplements. Or people who are almost most of the time nowadays sitting in the AC because they are working for long hours. What can they do? They have to go for the supplements, right? So there are several sources of vitamin D. Vitamin D is fat soluble, right? So mainly non-vegetarian sources are the sources of vitamin D, like fatty fish, like salmon, mackerel, tuna, then egg yolks, because the egg yolk is having more amount of fats, cheese, beef liver. Yes, these are the non-vegetarian sources. Some of the mushrooms also they contain vitamin D. Then fortified milk. If we have to vegetarian sources, they need to be fortified. Means externally vitamin D has to be added. That is called fortification. So we get fortified milks, fortified juices, fortified cereals of vitamin D. So these are the sources from where we can get vitamin D. So again, vitamin D is a very very important uh, vitamin for several other functions inside our body. People, those who are having thyroid issues, if a normal person like me who's not having thyroid, if I need one supplement, one tablet as a supplement, people, those who are having thyroid, they may need two or three because the thyroid hormone it disrupts the absorption of vitamin D, or it can be said in the other way also. Many a times, if the body is lacking in vitamin D, the thyroid hormone, the hyperthyroid hormone, it gets triggered. It disrupts the hormone secretion, and it will start creating, or it will start absorbing the calcium, because as I said, the thyroid hormone disrupts the absorption of vitamin D. So if the body is deficient in vitamin D, what the body will do, it will stop the thyroid hormone from generating, because it wants to store vitamin D, right? So those who are having thyroid, they need to check if they are having proper vitamin D or not. So as I said, there can be many complications if there is deficiency of vitamin D. So it is best to go for a supplement, or expose yourself to sunlight, or go and have the fortified or vitamin D rich foods. That's all for today. Bye. Do mention if you like what I'm sharing about the nutrition. Thank you.